Hello everyone and welcome to the Infection Control through Proper Use of PPE module. My name is Colleen Applewhite and I'll be your instructor for this module. A little about me and my background. I've been a registered nurse for 34 years, began my career in a hospital in Brooklyn, New York after earning my ADN in 1986 from CUNY Staten Island. Like most new nurses at the time, I began my career in a general med surgical floor. The floor had private rooms and soon became an AIDS isolation unit. It was early in the epidemic and we did not have all the information that we have now about transmission of HIV. I moved from the med-surg floor to dedicated AIDS unit where we had 20 beds and were usually always full. We practiced multidisciplinary case management for the patients and participated in pharmaceutical clinical trials as well as a program called Community Programs for Clinical Research on AIDS. I worked on that unit until 1991, so it was about 5 years total working with inpatient AIDS patients. It was hard, but also an exciting time for me professionally because I learned so much about infectious disease, case management, research, and basically hospice care. Personally, I was also the single parent of a very young child, and eventually the work became emotionally too much. I transferred to the pediatric primary and urgent care clinic. It was a much-needed change, and it was at that time that I decided that I much preferred the wellness model of nursing as opposed to the hospital disease-based model. I dabbled back into the outpatient HIV research studies a few times over the next 5 years, but pediatrics and community nursing always called me back. I left the hospital after 20 years in 2006 and decided to take a school nurse job as a public health nurse. When I began working in school, I felt like I had found a home. I was doing primarily wellness care and loads of patient education. Little children are sponges and they want to know everything. I did that for 3 years before relocating to North Carolina in 2009. I returned to UNCW for my BSN at that time after 27 years. And I minored in psychology just for the fun of it. I love school. I earned my BSN in 2013, got a job at my local county health department working in a middle school. It's a high-needs Title I middle school located in the downtown area, and the students have many needs. Some are health-related, but many are social problems due to home environments, neighborhood, and poor academic performance. I can educate and listen to my students every day, and it made me realize how much I enjoy education and teaching about optimal wellness. I earned my National Association of School Nurse certification in 2019, and I began the MS and Nurse Educator program at UNCW in August 2018. I will earn my MSN in December 2020. The current health environment we are facing has led me to question where I will go from here with my new credentials, but I'm sure it will include education. The current pandemic led to my decision to create this PPE curriculum. I'm excited to watch the novel coronavirus unfold worldwide. It reminds me of the unknowns we face with HIV and how far we have come. The PPE curriculum contains basic information about donning and doffing PPE to prevent contamination to yourself and others, as well as the PPE needed for each level of transmission precautions. Facility-acquired infections continue to be problematic in many healthcare settings, and I feel this PPE training module is essential for nurses and other healthcare workers. I've included several articles that have studied the use of PPE along with a PDF from the CDC for donning and doffing PPE and a link to the CDC website. The RN YouTube video is a demonstration of the PPE donning and doffing sequence. Lastly, I included 2 articles regarding the current PPE shortage we are facing in healthcare for your information. One includes nurses who have picketed due to the lack of adequate PPE. You may choose any of the articles, one of the case studies, or your personal experience with PPE at your institution to post in the discussion model. I hope you enjoy the module and stay safe and healthy. Please feel free to contact me at ca1507@uncw.edu if you have any questions or need further clarification for any information in the module. I look forward to working with you. Have a great day.